Lung cancer is the third most commonly diagnosed cancer and the leading cause of cancer-related death in the United States. For years, scientists have looked for ways to detect lung cancers at earlier stages, but the available screening tests, chest radiography, sputum cytology, and CT scan, just weren't accurate enough to justify their use. In 2011, the National Lung Screening Trial Research Team reported a 20% relative reduction in lung cancer mortality with low-dose CT scan compared to chest radiography screening. That and other recent trials of CT screening for lung cancer led the United States Preventive Services Task Force, an independent volunteer panel of national experts in prevention and evidence-based medicine who make evidence-based recommendations, to update their lung cancer screening recommendations. They commissioned a systematic evidence review to assess the ability of available screening tests to detect lung cancer in asymptomatic smokers or former smokers at average or high risk for lung cancer. They also commissioned simulations to model the optimal age to begin and end screening, the optimal screening interval, and the relative benefits and harms of different screening strategies. The result? Their 2014 guideline statement recommends use of low-dose CT scan in asymptomatic adults, age 55 to 80, who have a 30-pack-year smoking history, and who currently smoke or who have quit smoking within the past 15 years. They recommend annual screening with discontinuation of the screening if the patient hasn't smoked for 15 years. The recommendation is given a grade B, meaning task force members have moderate certainty that the net benefit is moderate to substantial. The task force emphasizes that the recommendation depends on limiting screening to people at high risk, accuracy of image interpretation similar to that found in the National Lung Screening Trial, and resolution of most false positive results without invasive procedures. They also emphasize that screening cannot prevent most lung cancer-related deaths and that smoking cessation remains essential to reducing lung cancer incidence and mortality.